Here's an interesting finding that I thought might be useful, perhaps for showing a patient. This is an eye with asteroid hyalosis. You can see these little white calcium deposits inside the eye. It's behind the lens in the vitreous cavity, and they float around just like floaters do. And as noticed by the patient, using a slit lamp beam, they really light up. Thought this might be useful just because so many people complain of having floaters, and you try to describe what's causing them. And even if they don't have asteroid hyalosis, this is a nice video to show this.
Watch more eye videos at routeatlas.com.
What we have here is an ocular finding that is difficult for the beginning ophthalmology resident to see. On the back surface of this cornea are guttae or guttata, depending on your background, but these are little bumps on the back surface of the cornea. You can see them here. They look like a beaten metal appearance on the back surface of this corneal light beam, and these form on the endothelium and decimase layer in the back of the eye. You see diffuse dystrophy, an important finding to see before cataract surgery.
Watch more eye videos at routeatlas.com.
Here's a common finding that I thought would be nice to document, if only for patient education purposes. Now, here's an eye, and you can see here along the eyelid margin these little white dots. These are actually the orifices to the meibomian glands. Meibomian glands produce oil, which is an important component to the tear film because that oil keeps the tears from evaporating too quickly. Now, normally when I push on it like this with a Q-tip, clear oil comes out. But here, you can see right at this spot and this spot, it's coming out not clear, but more like toothpaste, kind of white colored. This isn't normal. These meibomian glands are inflamed, and because of that, the patient's having a lot of irritation because your tears are evaporating too quickly because this oil is not working well.
Watch more eye videos at routeatlas.com.
The other test we do for sensory for the trigeminal is corneal reflex. The sensory level of the corneal reflex is, of course, the optical division of the trigeminal nerve. The blink that occurs with the sensory phenomenon would be from the orbicularis oculi, which would be the seventh cranial nerve. So I want you to look right on my nose. I'm just going to touch the very side, you can actually look at this. I'm just going to barely touch it, just tell me if you feel it. Feel that?